Hello students, so today we are going to talk about the Da Vinci surgical system, and as you know this is an example of a robotic system. Okay. Now I have already talked about several other examples like a robotic dog, right? This was from the Unitary company, right? But now today let us talk about surgical system. Now before we proceed with this video, it's important that we know what is a surgery. Now suppose this is a human body, okay. Now this body is not working properly. There is some problem with somewhere. Now what do the doctors do? They try to use techniques to figure out what is wrong with the body, right? Now there can be two techniques. One is to just use some machine outside and try to figure out, and another way is to cut open this body, okay, cut it out, some part cut open, and then try to figure out what is wrong somewhere. Now this second technique is known as surgery. So basically this surgery is either done manually by surgeons or with the help of instruments, right? Good. And why do we do this? As I told you, main reason for this is either diagnostic or reconstructive purposes, to find out if there is something wrong with it. And you know, as a result of this surgery procedure, doctors can treat a disease. So they can treat a disease or injury or other health problems. Understand? So basically the reason is treatment or diagnosis or repair, right? Even transplantation, some organ is not defective, is not working properly, so I have to transplant it. Okay, now let us talk about the various types of surgery. Now there can be various types. Today let us talk about the various types of surgery based on invasiveness. That means how much is opened human body. Based on this, we can have either an open surgery, and what happens here, this is a traditional approach. Basically the surgeon makes a big cut in the body, okay, and so the surgery is done, but it takes a long time to recover, and there can be other complications as well. And there can be another very interesting new technique which is known as minimally invasive surgery. Okay. Now what is this? This is a newer technique where we use basically small incisions. Now what is an incision? Incision is basically a small cut. Okay. So instead of a big cut, we use small cut. So this is a big cut, this is a small cut, but multiple small cuts. Okay, not one, but multiple small cuts. So it's like the big cut over here, I am basically replacing it with much smaller cuts. Okay. Now this will have advantage. I will be focusing on particular job and the recovery will be much faster. Now there are two very interesting types of minimally invasive surgery. One is your laparoscopic surgery, where we use a laparoscope, which is basically a thin tube with camera. Okay. So this is a laparoscope and tiny instruments to operate mainly inside the stomach. So this is laparoscopy. And next is the topic of today, which is robotic surgery. Okay. Now this is our topic. Here basically what happens is that if this is a, let me show you what happens in a robotic surgery is this. So this is the patient, suppose this is the patient, right, and here is the doctor. Now the doctor doesn't work directly on the patient just like the traditional ones. So what happens is that doctor operates on a machine, okay, and then the machine has another part over here which has got arms, very different type of arms, robotic arms, and these arms basically perform the operation. So the doctor is like playing a game. When you play a game console, the doctor is basically operating on the machine. The machine has parts and the machine does the operation. So effectively what is happening in robotic surgery is that using a computer controlled robotic system. So this entire thing is the robotic system, RS, okay, and here we will be talking about the Da Vinci Z system, and this basically assists the surgeon. And what are the advantages? First of all, it provides enhanced precision, and also the doctor can see live video of what is happening, because one of the arms I can replace with a camera and see this is what is happening. So here one of the arms has the camera, and from the camera what I am seeing over here is the two arms of the robot. This is the first arm and this is the second arm. The two arms of the robot, they are inside the human body and they are trying to do something. So I am observing, and this is the screen, okay. So I am able to observe directly, and these are not my hands, these are robotic arms. Wow, right, robotic arms. So this is basically what you will see as a doctor when you perform robotic surgery. So in a single line you can say that this robotic surgical system, okay, robotic surgical system, this basically enhances the surgeon's capability for doing the operation, and as a result now the surgeon can do more complex procedures with greater precision. This is the need of the time, precision, okay, as well as visualization, as I showed you in the picture, it can see, and this is just not possible, the visualization as well as higher precision with traditional surgery, okay. So now let us go back to our Da Vinci Z. So yes, the system has mainly, as you can see, three main components. So what are they? The first is the surgeon console that you are looking over here. This is the surgeon console, right. Now what it does is basically this is the control center where the surgeon sit, okay. As the name suggests, the surgeon will sit over here, and these are the various arms using which the surgeon will try to do the operation, and the operation will be performed by these robotic arms, okay, just I showed you some time back, right. And he will be doing this while looking at the vision card, this one. So here he will see the 3D vision of what is being going on, understand. Now let me show you in more details. So you can scan the QR code and see more videos. So this is basically what is known as the patient card, okay. Now let me write it down, patient card, the second component over, yeah, this one, patient card. So basically what happens is the patient is asleep after given anesthesia, and the table, it can be rotated according to the procedure, and then these robotic arms, they do their job, they try to do the operation. Now there are 4 arms of Da Vinci Z, right, and all these arms can have different type of instruments. They can be clippers, there can be camera. I will show it to you in a minute. So basically what patient cart does is it allows, it basically positions itself next to the patient. That's why the name patient cart. And this has basically robotic arms that hold the surgical instruments, and one of the arms there we have the camera to see live viewing, and the surgeon's movement from the control are basically translated in real time to these robotic arms. Okay. Now next, so this is what we talked about. So you see, this is the surgeon console. As you can see, the various parts of it, of the surgeon console. So basically the surgeon, this is where he will put his hands, just like this. See the hands, and try to do the operations. See the person doing the operation, and there can be various arms. So we can have a pre-coagulation type arm for incision. Next, for cut, we can, it is done like this. And so see, there are different type of knobs for doing this operation. Okay. Remember, this operation cannot be done entirely by the robotic surgery system. This is basically a computer assisted surgical system. That means this system must be assisted by the doctor, surgeon. It is the surgeon who is the controller. Remember this, the surgeon is the controller. Surgeon is basically doing the operation, but not by his own hands, but rather the robotic hands. Okay. Now see, this is the vision card. As I showed you, there are the various controls which are required to keep alive the various instruments, and here you will see the basically the 3D view of what is happening inside the body. Okay. Now before the operation, first what is happening is, after a patient is asleep on the table, it's make a 3D scan of the patient, and then they try to figure out the procedure, where the operation will perform, what will be the steps. So what are the steps for doing the operation? First, the doctor tells the computer its entire structure, that this is what I want to do to the patient, these are the issues. Next, after listening to the doctor, this is, remember, an AI enabled system. The machine, the robotic system, will scan the entire patient, and then it will make a plan, okay, a surgical plan. It will tell you, so we will start with the incision from here, first, second, third, fourth. 4 incision points will be there. First arm will enter from here. This will remove some skin, some muscles. The second arm will enter after that. It will remove some other part, and the third arm will have the camera, okay, to look over the entire procedure, and so on. So after looking at the plan, the doctor, the surgeon will again review it, and after reviewing, they will move through. If everything is okay, then they will successfully start the operation, okay, for a success. So see, this is how the patient is asleep on the table, and this is just one of the figures which shows the plan of operation, as I told you. So there will be various types of incisions, cut, and other types, and this is the place of our interest. So the robotic arms will try to access this part, okay, and see, this is how actual stuff looks like in the real world. So see, the entire robotic system is working above the patient like this. Yes, there are the various arms over here. Remember, these are the 4 arms of Da Vinci Z. And see, this is yet another plan. So this is how the operation will be done. So this is an arm. So this is more or less how things will happen inside the human body assisted by the robot. And this figure I already showed you how the operation is performed, okay, and with the monitoring through the camera with one of the arms. And look over here, what you see is the picture of one of the patient, basically a 65-year-old patient, and she has basically uterus operation where uterus was removed. And as you can see over here, just let me show it to you, instead of giving a big cut like this in open surgery, we are having 4 small cuts, one over here, another, and this one. Now next we will have different type of forceps. See, so this will enter the human body based on either they have to cut or they have to remove some muscles. So this is suppose a muscle, so one of this goes inside, it slowly shifts the muscles, then the next arm goes inside and does the work of cutting the uterus out, something like this. And then there is another arm through which the camera is there and it is already trying to observe what the 2 arms are doing slowly and gradually. So this is it. Now this picture is actually taken just 1 day after the robotic surgery, okay, and trust me, within 3 weeks she was very much healed. And this is the magic of robotic surgery. The healing is much faster compared to traditional surgery, okay. And now patient is very much okay, she is having a healthy life, all thanks to the Da Vinci Z surgical system, and of course the doctor who is the actual person who performed the operation. So dear students, I am now at an end of our video. I hope you like this. If you have any questions, do ask me.